Hi, Mr. Mohammed Irfan Agwan from Mauritius, 40-year-old gentleman, very positive individual. He was diagnosed to have a condition called Fuchs Endothelial Dystrophy. So if you look at the human eye, this is the cornea and this is the lens inside the eye, and these two structures help focus the image or the light onto the retina. Now in Fuchs Endothelial Dystrophy, in the cornea, the inner layer, the cells, they stop functioning, and because of which the cornea starts getting filled with water and the cornea becomes swollen. So morning when you get up, the vision is not very clear. So this is what was bothering him. He is a young individual, busy at work in his career and everything, and every day getting up in the morning with hazy vision is not something that he would look for. So when he came here, we examined his eye and we decided to do a highly specialized corneal transplant procedure called as DMEK, which stands for Descemet membrane endothelial keratoplasty, in which we replace only the inner layer of the cornea. So that means you don't exchange the whole cornea. The cornea remains his own. Just the inner layer of the cornea is replaced with the healthy cells that we take from a donor cornea. So this is done through a very tiny cut, and the recovery period is very fast. So that's why for him, he underwent the surgery, and in a week's time, he was already seeing very well with the first eye that was operated. And realizing that his fellow eye also has the same problem, and if he goes back, he would have to come back again to get the second eye operated, he decided to extend his stay and get the second eye surgery done. And that was only because the first eye had recovered so well. He underwent a similar procedure in the left eye, and a week later now both his eyes are doing very well. He is going back, new individual with no hazy vision in the morning. He can lead a normal life, do his normal work, and we are very happy that you came all the way and we were able to meet up with your expectations and provide you with the best of care possible at our hospital.
Thank you so much, Doctor.
Thank you.
I'm Mohammed Irfan Agwan. I'm 40 years old. I'm from Mauritius. And back there I was diagnosed with Fuchs Endothelial Dystrophy. And my treating doctor there advised that I should contact Dr. Fogla from India so that he can undergo some clinical procedures, which I eventually contacted Dr. Fogla. And when I came here, I would say it is definitely worth it. I left the country with very poor vision in my right eye. I came here for the right eye in the beginning, and then I was very much satisfied, so that I also went for the left eye. But for me, it's not only like I would highly recommend, but for me it's like the only choice. If someone has to do some eye surgeries, he should definitely choose Hyderabad Apollo Hospital, and definitely he should be choosing Dr. Fogla. Because for me personally, I have had like loads of satisfaction. Especially I've been talking to my family and saying Dr. Fogla is so friendly, so that you start feeling better, you start feeling reassured, you get the confidence to go for the surgery. So for me, as I said, it's not highly recommended. This is the only choice, I would say, to come for Dr. Fogla here in Hyderabad Apollo Hospital for any eye surgery. Thank you very much.